than normal length, but I get a muscular infield with symptom reproduction. I have a positive static test for his knee flexion, right? We haven't shown that yet, because Mark will show that when he gets to the knee. But he should have positive static test, strong and painful or weak and painful. He should be tender to palpation, right? How do I know that he's in the early fibroblastic phase? Movement diagram, what about the movement diagram? Yeah, pain and resistance are going to be super close to one another, right? So you're going to have to, as you do your 90-90 test, you're going to have to pay close attention to say, oh, there's R1, and oh, there my pain started, right? Don't just blow through and then go, oh, you feeling that? He goes, yeah. So you don't know where his pain started. Now you just know that he has 5 out of 10 pain, okay? So we do that, right? And then we can come in, then we would palpate, right? We'd say, okay, so based on his location, he says, oh, I feel it right here. So I come in, I say, is this a spot? Yes. So then I'm going to palpate, and then I'm going to feel for the margins. You know, I'll say, nope, that's not bad. Nope, that's not bad. Nope, that's not, oh, yeah, 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 nope, right? And I can almost draw the area. So I know the location of the lesion, right? So then I come in and say, okay, I have assessed and I say that he's tight here, okay? The only reason I'm doing this is because he's tight here. Okay, don't miss that point. The only reason I'm doing this is he has a positive 90-90 test. Or he's a hurdler that doesn't have normal hip flexion with the knee straight. But the only reason I'm doing this is because he's tight. Because this is elongating tissue. Okay? Now, in the acute phase, I can do approximation to promote nutrient exchange, blood flow. And so in the acute phase, right, he's in the inflammatory phase. He injured like yesterday. Okay? So I can approximate, and I can passively flex him and approximate. So now I'm bringing the two ends together, okay, and I am approximating the tissue. So I could do that if he had normal length here, but he's inflamed here, then I could approximate, okay. In the inflammatory phase, I could approximate, and then I could tack and stretch to elongate below the site of the lesion, okay. And you see that I'm using my hand, I'm lining myself up so that my force is going in line with his muscle fiber, okay? And this hand is straight and bolstered. It doesn't look like this, okay? I could, you could tack and stretch with your elbow if you wanted to. You just have to make sure that you can feel when you get to the point. How do you know if you've gone past your tack point? He's going to have pain. Right? So he should not experience discomfort with this. If anything, he could say, oh, I do feel a little bit of stretch between your fingers and my knee, but I don't feel pain. Or if he's in the inflammatory phase, I have pain, but it's not increasing. Okay, that's what you're going to use to gauge yourself. Okay, so I could come in and tack and stretch that way. If I was going to tack and stretch up here, then I'm going to have to bring him so that this leg is off the table. This leg is off the table. Okay, so now I'm going to support the weight of his leg. Okay, and so again, I'm going to approximate, right? Just remember, I'm always approximating towards the side of the lesion, and then I drop him into hip flexion. So I'm elongating between here and the origin of his hamstring. Okay? So now, again, I can raise the table, but my body mechanics have to allow me to move him through range. Okay? So that I'm coming through and moving him through range. Alright? So questions about tack and stretch?